So I want to discuss neurodynamics and the use of it in the clinic and clinical decision making, how we can use it as an intervention. I find a lot of times clinicians tend to not use this as an intervention. I'm not sure why. I'm not sure if it's because of a fear, not recognizing the indications to using it, just being, thinking maybe more if it's a muscle issue. But let's really try and dive into how we can use it, whether it is a cervical radiculopathy, some type of lower motor neuron issue, peripheral neuropathy, maybe into the acute flare-up from somebody using their hands too much, an athlete who grips a lot, a weightlifter, a CrossFitter, maybe a construction worker, and this issue can be chronic or acute, but we need to really look at the principles, and I find a lot of clinicians tend to use massage techniques, manual release techniques, which I guess the theory is to loosen up that muscle, which may be compressing it, but a lot of those manual release techniques actually require you to compress that tissue, which probably leads to you flaring up or irritating that nerve some more. Perhaps maybe cupping techniques to lift that fascia or decompress that neural tissue and allow that neural tissue to slide. However, it takes a lot of pressure, pounds of force to try and deform or move tissue. So are we really able to do, in theory, what we think we're doing with some of these other interventions? However, if we use some neurodynamic principles and use some gliding or flossing techniques, maybe some sliding techniques, and get that nerve moving underneath the tissue and get it to respond to some mechanosensitivity and create some of those changes within the blood flow and neurophysiologically, are we going to have some better results? As well as the nerves are what control the muscles and the joints. So why are we trying to treat the muscles? Shouldn't we go straight to the source and try and treat the nerves, which then cause that hypertonicity or that irritated muscle, that muscle that's tight? So just some things I wanted to try and dive into a little bit on an approach or decision making, what we're really looking at when we're seeing a patient with some type of nerve pathology, and how we can better use some of the other interventions at play that are probably a little bit more successful and have a little bit more validity and research backing it than some of the other approaches that are a little more passive and tend not to give us the great long-term outcomes, but maybe just give a patient a temporary relief.